In today's Health Alert, we're taking a closer look at a new treatment that could slow Alzheimer's disease, approved by the FDA. The drug Donanemab, developed by Indianapolis-based company Eli Lilly, will be marketed under the brand name Kisunla. To tell us more is our chief health editor, Dr. Partha Nandi, here with us today. And Dr. Nandi, clinical trials found Kisunla produced meaningful results, but also carried some serious safety risks. What more can you tell us?
Yeah, it's exciting stuff to me because of Alzheimer's. So Kisunla is a monoclonal antibody. It helps remove sticky amyloid plaque buildup in the brains of folks with early Alzheimer's disease. In late-stage clinical trials, the drug showed cognitive decline in patients with this memory loss disease, and those who took Kisunla had a 35% lower risk of their condition worsening over 18 months compared to those who received a placebo. However, there were rare but serious risks. This is important. 3 patients died after developing the Kisunla for short for amyloid-related imaging abnormalities, which can cause brain swelling and bleeding. Now, these brain changes can be identified in MRI scans. Because of this, the drug company added an additional MRI scan. If ARIA was detected, treatment was paused to allow the brain to resolve the issue, since it's usually temporary. Overall, during the trial, 2% of patients who took Kisunla died, compared to 1.7% of the group that did not.
Now, doctor, how does it compare to other drugs already approved to treat Alzheimer's?
Yeah, it's important, right? So both Kisunla and Leqembi slow down dementia by targeting amyloid plaque buildup in the brain. They're lab-made antibodies given intravenously in trials. Leqembi also caused ARIA, which less often than Kisunla. Leqembi also has been linked to patient deaths. Now, there are 2 main differences between the drugs. One is how often they're given. Kisunla is administered once a month, while Leqembi is twice a month. Secondly, Kisunla can be stopped once the plaque is barely detectable in the brain. In the trial, 47% of participants stopped using the drug after a year, and 69% stopped after 18 months. Amazingly, their mental decline continued to slow down even after they stopped taking the drug. This is a major plus, right? Because Kisunla is not cheap. Predicted costs are $695 per vial before insurance, and that adds up to $12,522 for 6 months, or about $32,000 a year. That's a lot, Simon. So it's great that there's another treatment, right? Option for Alzheimer's disease. This memory-robbing chronic brain condition affects about 6.7 million Americans, with numbers predicted to rise to 14 million by 2060. Now, while Kisunla is not a cure and works best in the early stages of the disease, it could potentially help with folks with Alzheimer's live longer and more fulfilling lives. I'll tell you, nothing is more scary for my patients than losing their mind and Alzheimer's. So any treatment we have to help with this is promising, but we have to know that there are some serious side effects, and you have to talk to your doctor about, hey, is this right for you?
Yeah, certainly speaks to quality of life.
100%, 100%.
Doctor, thanks for being here
with
us.
My pleasure, of course.
This week on the Dr. Nandi Show, thyroid problems are often overlooked or misdiagnosed. Join Dr. Nandi and his expert guests who unlock the mystery surrounding this very important gland. Dr. Amy Myers tells her own personal story about having a thyroid disorder and how she's helping other women with similar issues. Plus, author Rock Robbins has the harrowing story of his wife's journey with thyroid disease and how it affected their marriage. Tune in this Saturday, July 6th at 12 p.m.